advantages with our system. We do not have an electric system. The SAM driver, IO driver, is purely manual. So basically all of the concerns or the issues, the negatives that we have with electricity, we don't have here. No one needs to check charging levels. No one needs to be afraid of, do I have a green LED or a red LED? Is this running flat? How many more procedures do I have? What's the coal going to do to my battery if we look at mountain rescue or military settings? What am I going to do with the hazardous waste? How do we get rid of it? Because you can't change the battery, right? You have to dispose of the whole drawer. We're looking at about 72 grams in weight, so it is purely, it's very lightweight, no issues on that side. The needles are obviously single use. This is, as I've mentioned, the sterile needle pack. The end user has all the data that he requires. The needle length is provided, everything else that he might need to know. And we just purely open it, and there we have the contents, the needle, the extension tubing, and the needle vise. Going back to our driver and the procedure, the paramedic, the end user, whoever it is, chooses the appropriate needle length according to the patient. And what are we, for example, looking at? We would be looking at needle length and tissue depth or thickness. We would assess the site and then make a decision, what needle length do I actually need. So we didn't color code the needles according to adults or yellow. It really depends on patient. If you say this patient does not have a lot of tissue at the site, I am pretty certain that my needle length, the blue needle length, is going to be successful. You need to be aware of the black lines, and we need at least one black line showing once we are resting on the bone. So the black lines are of importance. So basically, how would all of this look? I just want to recap this. We would assemble the driver to the needle, which is purely that motion. How should I say? It's a sticking motion. I just place it together. I don't have any threads. I don't need to screw anything. There's no magnets involved. It's just purely in and out. So I stick it in, and I then remove the cap. Find my landmarks, and then basically penetrate the skin with no drilling motion. I purely push through, puncture the skin, puncture the underlying tissue, and rest on the bone itself. And when I'm resting on the bone, this is the moment where I do a final check, and I see, okay, I've got at least one black line. In this case, I've actually got two black lines showing. That then tells me I have enough needle length to penetrate the bone and then reach the space where the bone marrow is. If there is no black line showing, the danger is that my needle length is too short. So then I would need to switch out needles. So in this case, I'm just going to support the simulation bone. And then we start, I'm resting on the bone, and we start the drilling process. And in a lot of cases, we realize people are pushing way too hard. We see much too much pressure. I'm pushing hard now. I'm creating the needle to bend. We don't want that. It's not needed. The needle needs to basically drill through the bone. And we've seen, or our experience shows us, that users who are coming from electric drills are underestimating how much they are actually pushing. Mm-hmm. And only when they do this with our product, where there's more tactility, they realize, oh wow, I've always pushed quite a bit. So no pressure initially. We just want the drilling process to start. We want to have that initial bite. The drill is biting into the bone. And once I've got that, I'm gently guiding the needle and starting to accelerate. So I'm going to stop talking now. I just want to concentrate on the drilling. And I'm watching for loss of resistance, which I've just felt. And then I'm dropping into that marrow space, and I've achieved my purpose. I then remove everything. I'm holding on to blue, and I just remove the needle and the driver, and I would now place this into the needle vise. which I'm not going to do. I don't want to lose the needle for training purposes. In real life, I would do this. So that would then stick in the needle vise, and I can release the driver, put this back in my bag. I would disinfect it for later use, and then I would focus on my procedure. So this aside, this has now been disposed of safely. I would then take my extension tubing, which would have been flushed. So the air has been removed, and I can then basically connect it. So I remove orange. Orange goes to the patient, and I could then connect this to my giving set or to my posi-flush or whatever else I have. And then I would proceed according to a protocol. If the service says I need to flush or aspirate, whatever is needed, that can then be achieved at this point. Some services still say we need to aspirate to see that bone marrow comes back. Others are saying no, so I leave that up to the services. It's not up to us to dictate that. The same goes for use of lidocaine. It has gone out of some of the guidelines. We as a manufacturer do not say what the end user must do or not do. So the aspiration and the lidocaine is according to protocol.